of the switching gears again, all the Republican candidates have talked about repealing Obamacare, repealing the Health Care Reform Act. How is your stance different from the other three, and what would you do to replace it?
I don't think any of us are different on that stance. I think we all want to repeal it. I just think you have to get to a market-driven approach. And as Speaker of the Assembly, we were finally able to get through the health savings accounts. But I don't trust the government or insurance companies to make healthcare decisions for myself or my family. I think it should be put in the hands of the people to make those choices, and getting away from the lose it or use it mentality. So if you have a family plan and, your business, your company is going to put $1,500, instead of just paying that $1,500 for the month and you either use that healthcare or you don't for that month, put that into an account that it is an account that it can accrue and can build. You're in charge of those dollars. I think the real problem with healthcare is the transparency. There's no transparency in healthcare anymore. We don't know what specific things cost. I think that's a real problem. So, everything else we do has to deal with consumerism and competition, in the marketplace here in the United States, except healthcare. And I think that's a real problem. Here in Wisconsin, we never really had a problem with access. We've had a problem with the cost of healthcare. The example I use is LASIK eye surgery. 15 years ago, I'm not sure what it cost, but $3,500 per eye or whatever when it first came out. Very expensive. Now you can go online on your computer there, Lee, and probably pull up 40 doctors in the area that perform that procedure, get testimonials, and it's driven the price of that down to now you can get it $1,500 for both eyes. So putting competition back in the marketplace for healthcare. I think if you look at Obamacare, you're just kind of looking at another entitlement that I think will come and I believe that will bankrupt our system. When you look at the entitlements, Medicaid, Medicare, Social Security, the interest on our debt, by the middle of next decade, you're looking at all the federal dollars really going to those programs. Now you look at Obamacare. I'm just afraid we're getting to the place where a lot of Europe is right now, where you've had a lot of promises made by politicians and they can't deliver on those promises anymore. So they're not only not reforming the stuff they have, now they're pulling the rug out from people that have paid into a system that now no longer are going to receive those services. I thought it was a staggering account that AP just did the other day that now shows that Social Security, if you're retiring now, you have paid more in than the benefits you're going to receive. And when it was first started, there were 5 people working for every person on Social Security, where now that's getting down to almost 2 people working for every one.
How do you interject market-driven forces into the healthcare market? How do you do that? What role is there for government in making that happen?
Yeah, I think if you look at it from, I've endorsed Paul Ryan's plan. I think when he looks at the voucher system that he uses, I think Medicare. It's for Medicare is a way to drive into the private sector, to do that. He talks about state exchanges that you can go through and purchase health care. I think that's a way to do it. And then I also think that through private employers that like I said with the health savings accounts, that if you put people in charge of their own dollars, it's going to help drive that cost down. I just believe that because I think if you're able to take those dollars, take it with you if you change jobs or whatever, you're in control of those dollars, not somebody else. So you get away from that use it or lose it mentality.
But even some of those who are critical of the Affordable Care Act like certain aspects of it, such as the keeping kids until 26 or the pre-existing conditions.
Yeah, and I think under Paul Ryan's plan would allow, if you're purchasing that insurance, that through those state pools, that those are things that would be still offered in there. So.
And would you favor that?
You know what? That's a very popular thing, especially the pre-existing conditions. So if you can purchase that, yeah, absolutely.